Millions of Americans, including seniors on food stamps, are about to lose their benefits this September as President Trump's new rules kick in. We've already heard reports that food stamp benefits are disappearing from EBT cards across the country. And the most impacted groups, the biggest groups that are affected, are seniors, people on disability, and veterans on fixed income that are hardest hit. And so, what I'm going to do today is that I am going to walk you through steps that you can take to be able to tap into resources that can help you put more food on the table. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I have been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that affect seniors both in and out of Congress. If you are new to my channel, welcome. I am glad you're here. Do me a favor and go into the comments and let me know your city and your state, because I like to know where you guys are watching my broadcast from. And then if you've been watching my channel for a while, welcome back. I am glad you are here. We have a lot to cover, including this breaking news about millions of people, including seniors, losing their food stamps benefit. And I'm going to share another headline for you to see how serious this issue is and why it needed to be addressed today. And this is from CNN. It says that 2.4 million people expected to lose food stamps after Trump's agenda law broadened work requirements. And so let's talk about it, because this is going to impact seniors, veterans, and people on disability the most. And so I want to walk you through what you can do to put more food on the table and to be able to keep your food assistance benefits. So let's start with the big news. So what happened was that the big beautiful bill expanded work requirements. So adults age 18 to 54 now were previously required to work to get food stamps. That age 54 has been increased to age 65. So that's how more seniors were caught up in this. So we moved from age 54 to 65. So if you're an adult receiving food stamps and you are between age 18 and 65, you need to pay attention to this. And if you know somebody that's on food stamps, you need to send this video to them, because these rules have already started on September the 1st, 2025. And so let's talk about it. Now, it says that a historic change in how Americans buy groceries is underway as SNAP benefits cuts begin. So let's read from CNBC. On Monday, changes to the SNAP program go into effect, with CBO analysis forecasting 2.4 million fewer Americans, including families with children, will receive federal food benefits monthly. And so it goes on to say that on Monday, under new policy included in President Trump's tax law, SNAP benefits that have provided low-income Americans with more purchasing power in grocery stores begin to go into effect. According to one estimate, the largest cut to SNAP in history, a federal program which, in one form or another, dates back to the New Deal and currently provides food assistance to more than 40 million people. Yes, 40 million people depend on food stamps for nutrition assistance. And so, what does this mean? What is going on, and how is that going to impact you? Well, what happened is that the new requirements is pushing more people off food stamps, because the work requirement have been tightened, and more seniors and veterans and people on disability have been caught up in the rule changes that is going to require them to provide more documentation to justify why they need food benefits. And so I am here to tell you what you need to do in order to keep your food stamps benefit. And I'm also going to share with you resources that can help you get more food assistance outside of food stamps. But let's look at CNN and go through what they are reporting as the changes that we can expect as this law goes into effect. So CNN says that some 2.4 million Americans are, including families with children, are forecasted to receive food stamps benefit, you know, are forecasted to receive fewer food stamps benefits as President Trump's agenda kicks in. And Other recipients are expected to see their monthly assistance shrink. We've already heard this from a lot of people who are reporting back that they went to see their EBT cards and were expecting a certain amount, and now the money is gone or the money has been severely cut. So, guys, this is real. This is happening right now. And I want to make sure that you are aware and know what to do to keep your benefits. The law requires parents of dependent children to work for their food stamp benefits for the first time. However, it says that fewer people will lose nutrition assistance under the final version. So that's a little bit of good news. Now, let's go to what is happening. The CBO released several reports that looked at the impact of the law, and it is saying that on those who receive food stamps, Medicaid, and Affordable Care Act coverage, they are going to be those who are going to be impacted the most. Now, also, the law requires that ages 55 to 64, veterans and people experiencing homelessness and foster care youth to meet mandates. So here is where I want to bring your attention, right? Right here. So what does that mean? Well, let's talk about what these new rules are and what you need to know. So the first thing you need to know is that there are tighter eligibility requirements. Gross and net income threshold remain, but more able-bodied adults must work and complete complex paperwork in order to get their benefits. And then you're going to need more proof. Recipients must routinely submit documentation of work, volunteering, or training to keep their benefits flowing. And overall, SNAP spending is supposed to drop by $92 billion, which is going to cut a lot of people off food stamps. So that is what you need to know. And there are some other changes that are happening, including states that are eliminating junk food. We've already heard that in a lot of places, junk foods are being taken off food stamps in many, many states. So let's read some more from CNN. So I am going to highlight a specific section of their article and then help you figure it out. So it's saying that another controversial provision requires certain states to pick up the share of food stamps benefit for the first time. States with error rate of at least 6% will have to shoulder 5 to 15% of the tab starting in 2028. So what this means is that they are pushing more of the funding of food stamps to states. Traditionally, food stamps has been funded by the federal government. But when you push it to states, now states who do not have the money to finance that portion are just going to cut people off food stamps. So we are getting into an era where fewer and fewer and fewer people are going to be eligible for food stamps as states are required to pick up more of the tab for a program since the New Deal has been a federal funded program 100%. Now, let's talk about junk food because there's been a lot of restrictions about junk food. So, select states can now block SNAP funds from being used for candy, soda, and other junk foods. Texas, Oklahoma, Florida, Louisiana, they have restrictions in place to disallow people from food stamps to use their benefit to buy junk food. Now, supporters argue that this pushes for healthier diet for recipients, but critics worry about less choice and dignity. Small groceries must update their systems to comply with this rule. Now, let's talk about the impact of this rule on seniors. But before that, let me talk about food stamps eligibility for seniors before we get into the specific changes that are happening for seniors. So I am going to share an image that shows you how food stamps for seniors are calculated and what you need to know about SNAP changes. So for 2026, sorry, the SNAP level is 165% of the federal poverty levels for seniors. Now, 100% of the federal poverty level is $15,650. And so you can see that if you are a senior citizen and you're making like $1,000 or $1,200 in food stamps or Social Security benefit, you qualify for food stamps. The problem is that a lot of seniors apply and then they get the minimum benefit, which is $25. And so, how can you avoid getting $25 and getting more of the food stamps benefit that you qualify for? Well, is by complying with the requirements. So, if you're a senior citizen, your income limit for food stamps is 165% of the federal poverty level. That is $2,152 a month in income. And if you're a family of two, $2,909. That is the eligibility requirement. And then beyond that, you have to comply with certain deductions that you can take in order to give yourself a chance to get more benefit. So there is a standard deduction of $209 that everybody gets to take. And then there are additional deductions, and this is where seniors drop the ball, because you can get deductions for some health costs that you are facing. You can get some deductions for some utilities that you use, but a lot of seniors do not provide those documentation, and so they end up missing out on benefits that they deserve. And then how much in food stamps can you get? Well, the maximum benefit you can get is $292 as an individual, maximum benefit. And if you're a household of two, 536. So if you meet the minimum requirement for a senior, which is, you can see there, is 2,071, for everybody else is 1,632. So seniors have more room to qualify for food stamps. But the problem is that a lot of seniors do not take advantage of all the deductions that are available to you. And that's why some seniors are not able to get the entire benefits that they deserve. So, if your food stamps benefit is being cut, what should you do? That is what I want to talk about. And there are steps that you can take, and there are resources that are available to you as a senior citizen in order to get more benefits. So, let me again share my screen, and then I'll walk you through some of these specific things. So, this article talks about, people ages 60 and over, with certain incomes can qualify for food stamps. And I've already walked you through that. While those eligible for Medicare may get food allowances from certain Advantage plans. So I don't know if you know that, but certain Medicare Advantage plans can also give you a food allowance. Additional programs may also help you get direct access to food. However, many older Americans in the United States find it difficult to access a steady supply of food, whether because of limited income or food scarcity in their areas. Food insecurity is said to be at least 1 in 15 adults over 60. Among those age 65 and older, rates of food insecurity have continued to rise, reaching 9% in 2022. So now that Medicare food stamps are being cut, what can you do? Well, the first option is to get food stamps, which we've talked about. But in addition, a person may be able to get food allowance from certain Medicare plans. Original Medicare Part A, Part B does not provide food allowance. However, Medicare Advantage Plan C, particularly special needs plans, may offer grocery stipend or flex card that you can use to buy food. So that is one way to get food benefits, by getting Medicare Part C plans. Now, I have talked about the fact that there are other resources that seniors can get in order to supplement their food assistance, and here's one of them. One, the Commodity Supplemental Food Program. What it offers is a monthly box of free groceries. It is run by the USDA and is distributed by local agencies. You have to be 150% of the federal poverty level. Then there's the Seniors Food Farmers Market Nutrition Program, where it gives you a coupon to buy fresh local food. It is administered by each state, and adults age 60 plus with income within 185% of the federal poverty level qualify. And then there's Meals on Wheels, low cost homes delivered meals. It is run by community organizations with federal funding and state funding, and seniors age 60 plus can get benefits from Meals on Wheels. And then there's the Emergency Food Assistance Program. It's free or low cost food through food banks, pantries, and soup kitchens. It's free or low cost home delivered meals, and it depends on the state, but generally based on income and federal poverty level. And so, what I'm trying to say is that there is assistance programs out there that can help seniors who face food insecurity. And if you are disabled, here are some other things that we should talk about. So, more, veterans are impacted by food assistance cuts, especially with SNAPs, and aid organizations and advocacy groups are overwhelmed, especially food banks, in trying to meet the needs of disabled veterans. So, how can you get around, or how can you comply with the new rules around food stamps? The 20 hours a week thing, how can you get around it? Well, one way to do that is to volunteer or train. The most direct route is working or volunteering at least 20 hours a week and reporting it. You can also apply for exemptions. Older adults and people with disabilities should promptly file medical or age-related exemption forms, which allows you to get exempted from the rules. And then watch for letters and notification about required documents and then respond to it quickly. So if the food stamps agencies reach out to you and ask for more documents, you need to respond to them very quickly. And then seek help. Local community organizations provide food assistance, and you have to ask because a lot of seniors are uncomfortable asking for help. But in this situation where millions of people are losing food stamps benefits, it helps to just ask for assistance. And I've talked to you about a lot of the ways that you can get more food assistance. But here are also ways you can stretch your food budget. You can also go to farmers market that participate in the double bucks program, where you can double your food stamps benefits by buying produce. You buy $20 of produce, and then you get $20 of produce free. That is happening in almost all states, in most food farmers markets. And all you need to do is sign up and show up with your EBT card to be able to get more food assistance, and get food help. So I hope this has been helpful to you. Before I leave, I want to talk about Medicare, because we are getting into the enrollment season, and there is a lot of changes that are happening, and a lot of seniors are finding themselves in the wrong Medicare program, or they are finding that their Medicare programs are being dropped. And so here is help. Our partner, Chapter Medicare, is there to help you navigate this Medicare open enrollment season. Chapter is there to solve one problem: to make Medicare easy to understand so that you can get the most out of your benefits. Why is it important for you to get the most out of Medicare? Because you have earned, you've paid into it, and you deserve it. And so, but Medicare is not one of those things that they will automatically just put you in the best program for you. You have to navigate the rules yourself and find the best Medicare program that fits your need, whether it's traditional Medicare or Advantage plans or other plans. But how do you sort through all the 24,000 Medicare plans that are out there? And that is why 90% of all seniors are in the wrong plan, because it can be challenging, but that has consequences. Being in the wrong Medicare plan costs you about $300,000 in Medicare spending over your retirement. And it can affect your health, because access to the right services is important when you need it. And so, Chapter is one of those organizations that are coming to this problem from experience. One of their founders actually saw his parents struggle getting into the right Medicare program, paying hundreds of dollars that they did not have to pay, and not getting the quality of care they expected. And that motivated him to want to set up a Medicare advisory company that helps seniors get the best out of Medicare. So they are not there to sell you anything, they have there to point you in the right direction. So over 2,000 of our members have already called Chapter and gotten help with Medicare. So call the number you see on your screen, 539-205-2147, or go to askchapter.org/insider. And here's what they're going to do. They're going to look at your current Medicare plan. If you're in the best plan, they'll tell you. If you're not, they're going to look into your local area and find the best plan that meets your budget, the care that you need, the coverage that you want, and the services that are crucial to you. So give Chapter a call today or fill out the form in the comments or in the description to this video, and they will reach out to you and help you get the best out of Medicare. You've earned it. You've paid into it. Why not get the best out of it for a plan that you deserve? So give Chapter a call today. And that's all I have to cover today. If you like what you heard, give it a like, give it a thumbs up, subscribe, and I'm looking forward to seeing you all tomorrow.